Hello, my name is Dr. Doeun Lee, board certified endocrinologist. What supplements should I be taking? That's the topic today. That's one of the most frequently asked questions in the office. Doctor, what should I take to enhance my health? I do recommend three non-negotiable supplements. And so if you're not taking these supplements, I do recommend taking. First is creatine monohydrate, which is really non-negotiable because there are so many benefits, so little downside, and it is so inexpensive. It's very affordable. I would say about $30 for 90-day supply. So creatine monohydrate, what it does is for the muscle mainly is it's going to retain hydration, fluid into the muscle. So you do recover easier and you have less muscle fatigue. However, there are so many non-muscle benefits, including brain function, antioxidants, anti-inflammatory. I do take 5 grams of creatine monohydrate, which can be increased to 7.5 milligrams or even 10 gram. Sleep deprivation, patients with sleep deprivation are helped by increasing creatine supplementation dosage. So the studies have shown 20 grams of creatine supplementation in the case of sleep deprivation did better in terms of brain performance. Apparently it does enhance ATP-dependent processes that's involved in brain function. So creatine monohydrate is non-negotiable. Another recommendation I have for you is melatonin. Melatonin, I thought, was only produced in pineal gland, and it does not get produced from any other glands. And also, it doesn't do anything but sleep. However, when I researched this topic, I found out there are a lot of non-sleep benefits of melatonin, including most prominently antioxidant benefit, scavenger for reactive oxidative species. Therefore, I do recommend melatonin with varying dosage depending on manufacturer. I do take natural and I take 3 milligrams of sustained release melatonin. And so I do take it at night. Obviously, I don't want to take it in the morning. So that's what I recommend for you. I would take it pretty much every single night. Another thing I recommend is K2 supplementation for muscle cramp, bone health, and cardiovascular health. So K2, I was really brushing it off as no good supplements. I mean, why would you take K2 if you have enough vitamin K from your diet? So I didn't really think much of it, but then I was talking about cramp. Why are we getting cramps when we're older? I mean, do you recall having a lot of muscle cramps when you're 20 and 30? No, I started having muscle cramps only after I turned like 47. So I was wondering, why am I getting muscle cramps? I always thought it was related to dehydration and electrolytes imbalance. And so I always recommend taking potassium, calcium, things like that. However, it doesn't seem to help. And quinine does help. However, due to potential toxicity, we don't recommend it as a routine use. What I found out is K2 has been studied, and actually, when you take K2 180 microgram per day, the study subjects actually the cramp frequency was reduced by from 3 episodes per week to 1 episode a week, even after 1 week of supplementation. So I immediately bought K2 and started taking it. And I actually have to say, I do not experience as many muscle cramps. I used to experience it pretty much every single day, at least, like a few seconds episode. However, I don't. A lot of K2 supplementation do have also D3 in it. However, D3 in D3K2 bottle tend to have really high dosage of D3, 5,000 IU. So you need to look at something that has a little bit less D3 because there is toxicity of taking too much D3. So when I looked at the supplement D3 and K2, most supplements have 5,000 IU of D3, and that's too high for daily consumption. When I see patients who are taking vitamin D3, 5,000 IU, oftentimes after 6 months, their D level would be 80 and 90, often over 100. And vitamin D is named vitamin, but it is really a hormone. And as with any other hormone, hormone levels should be in narrow bandwidth. And so vitamin D also, we do like to keep it between 30 and 60. And so in order to keep it in that narrow bandwidth, you need some blood work, but also vitamin D supplementation, 5,000 IU a day, it is too high. And so I do recommend somewhere between 1,000 and 2,000, not higher unless you have some absorption issue. You had gastric bypass surgery, or you have other, gastric issue where you are not absorbing nutrients very well, then obviously you're going to need higher dosage. So I found online a Thorne D3K2 product actually has the least amount of vitamin D, which has 1,000, which is perfect. And K2, which was close to 2,200 microgram, which is what we recommend exactly. And so other D3K2 supplementation will have 5,000 IU of vitamin D, and then K2 of 100 microgram. So a little bit too high D and too little for a K2. So we do recommend Thorne products. And actually, because Thorne is expensive vitamin company, I thought it was very expensive, but I found out their supplements are about 600 serving for $32. So it actually turned out to be the cheapest. So try that out. I think your cramp will be better. And K2 have other benefits of bone health and cardiovascular, in that it does help mobilize calcium from the vasculature to the bone. So I think it's helpful for many different areas. And so I do recommend creatine, I do recommend melatonin and D3K2 very highly. Other supplements can be, taken as well. I do take fish oil for my dry eyes. Some people take omega-3 because their fish consumption is so low. But if you're eating fish twice a week or more, you probably don't need omega-3 or fish oil supplements. Because also omega-3, if you take too much, has been associated with increased risk of atrial fibrillation. So 3 non-negotiable and some optional choices I did present here. And so hopefully this video was helpful in shaping up your supplements. And in terms of other thing I wanted to talk about is actually peptide. And because oftentimes I do get asked about peptide therapy, like whether I do recommend it or not. I think it is. I don't have a lot of experience. I have read a lot about it. And really, human data is very much non-existent. And so until I do get long-term human data and safety data, in other words, I would not recommend routinely taking peptide, with an exception of GLP and GIP, which is also peptide therapy. So that's what I recommend. Don't waste your money. I think your best bet is really just get all the low-hanging fruits first. And then if that's still not enough, then possibly you can benefit from taking some other stuff. But if your sleep is good, nutrition is good, exercise is good, your stress management is good, then I don't feel like you would need anything else. So other than those 3 things that I did talk about. So I hope that was helpful, and thanks for watching.